Hello everyone, this is Kathy in RWSN3B again, and today is episode 2 out of 4, and today we're talking about the body spark plugs, which are the electrolytes and its imbalances. So these are the tiny molecules that are considered spark plugs of the body, especially in the nervous system and the heart. And when these electrolytes and spark plugs are off, chaos ensues inside the body. There are a lot of electrolytes in the body, so we will be explaining them in lightning fast speed as fast as possible. So the biggest rules include sodium. So for hyponatremia, we can correct this through the management with the academic flow, which is no more than 8 to 10 mg per liter in 24 hours. This is to prevent osmotic demyelination syndrome, and severe cases can get 3% hypertonic saline solution. For hyponatremia or higher levels of sodium in the body, we can replace water slowly as well with hypotonic fluids such as D5 water to prevent cerebral edema. For potassium levels or hypokalemia with low potassium levels, we must never give an IV potassium as a bolus. The maximum rate of this should only be at 10 mg per hour via the peripheral line. As for calcium levels or low hypocalcemia, symptomatic cases need urgent IV calcium gluconate. So for the other electrolytes such as the phosphate and the magnesium, we must think of them as having an inverse relationship. So when one is higher, the other is often low in levels. So when we talk about hypophosphatemia, we need to do the acronym POP, POP, to pop it back in. For severe cases, IV phosphate is used. A caution for this phosphate imbalance is that rapid IV replacement can cause dangerous hypocalcemia. And if the phosphate levels, however, are high, we must need to bind it. So we must give phosphate fibers such as calcium acetate or sevelamer together with meals so that it can block the absorption. Dietary restriction is also key in the phosphate imbalance. The for magnesium, which is our master regulator in the body, when the magnesium levels are low or hypomagnesemia, we must treat the severe cases with IV Magso while remembering the correct magnesium levels to fix potassium and calcium. For hypermagnesemia or higher levels of magnesium than the normal range, this often happens due to renal failure added with magnesium intake. So in here, we must administer IV calcium gluconate to stabilize the cardiac membrane as it acts as a physiological antagonist. So if hypermagnesemia happens, we must administer IV calcium gluconate to immediately stabilize the cardiac membrane. However, if the hypermagnesemia is very severe along with its symptoms, the definite treatment for this one is dialysis. I think as a nursing student, I should very much review and familiarize myself more on these electrolytes because I think most of them, if not all, are very interconnected with each other. So, you can't treat something if you don't treat the other electrolytes first. And I think that, I need to read more on the electrolytes that need the most prioritization so that when I can solve that electrolyte imbalances, maybe I can do more on the other imbalances that are happening in the patient as well. So to further understand and apply our learnings for today, we will wrap this video up with a realistic nursing scenario. So here we have Mr. Jones, a patient with chronic kidney disease, who accidentally took too much antacid. So this is a magnesium-containing medication. And now he has severely high levels of potassium or hyperkalemia and low reflexes. So the management for this specific patient is prioritizing and starting with the heart. This is because hypokalemia, the electrolyte associated with it, is a medical emergency due to the high arrhythmia risk. And so we will use another strategy mnemonic called the CIKE or cake to shift the potassium levels down. So C, we have calcium gluconate. This stabilizes the heart membrane immediately. We have A for albuterol or insulin plus glucose. Next is K for Kayexalate. This is also known as your sodium polystyrate sulfonate. And last one, we have E for elimination. We can remove potassium through dialysis or medications such as diuretics. So that would be all for episode 2, which is the management of electrolyte imbalances. Once again, this is Catherine Arda, SN3B, and thank you for listening to this podcast. And I'll see you in episode 3. Bye-bye!